Well, thank you. I would like to start out by thanking Julio and all those who have organized this for their kind invitation to join you. I actually spend most of my work at present, although I'm transitioning or migrating, as Luis likes to say, with Caritas Internationalis, which is a confederation of national Catholic social welfare, humanitarian, development, and health organizations. We have 165 national members throughout the world. And we prioritized HIV and AIDS since 1987, so it was one of the first major church organizations to put such effort on HIV and AIDS. Just some of the things that I'd like to do during the last couple of years between the Melbourne, the Vancouver conferences, we spent a lot of time trying to collect and report data. A lot of people would say to us, "You're nice people, but we don't know what you do. We don't have your data." So we've tried to do that, and you'll see some of the things we've done with that. We've also continued strong advocacy for equal access to early diagnosis and treatment for mothers and children living with HIV. And much of this came from Julio's inspiration in 2014 when he joined us for a treatment conference in Rome. And when we saw how much he was pushing, especially the treatment as prevention, we also noticed the lack of attention to children. And so we wanted to work on that much more strongly without giving up our work on adults. And then also trying to facilitate dialogue among different key stakeholders to find the ways that we could work together to overcome the barriers to early diagnosis and treatment. I gave some of the data that's now in this published research report at the Vancouver conference in the Treatment as Prevention program. And so I won't go into that data again, but just to say that the participants in this kind of research that we did, which was through surveys and then in-depth interviews with people involved in treatment, really showed tremendous results in terms of outreach, especially to rural and marginalized groups that many governments could not reach through their own health systems, and then also the retention and care and the lowering of viral load. And so we have the data, it's in there. I reported some of it last time. I didn't want to go through the numbers again here. But then also, we worked to bring together in Rome in April of this year, and much of that was due to the leadership and the help of Ambassador Birx and Dr. Lours. We brought together more than 100 people engaged in pediatric treatment, mostly working in faith-based organizations, not just Catholic ones, but across the board, Christian ones, I would say, for the most part. And also with government representatives. Also, both Ambassador Birx and Luis stayed with us for 3 whole days in the meeting, and Ambassador Birx even offered to take notes for one of the group sessions, and she did a good job too. We had the leadership of this work together with us throughout the time. We had government representatives of people, groups of people living with HIV, and also you'll hear we also then involved some of the private sector at 2 follow-up meetings. All of the people talked about what they were facing in terms of the challenges that they face, and especially some of those challenges involved stockouts. It involved funding cutbacks or funding flatlining, and also the continuing need to go out and to find those who had not been involved in treatment, and especially the mothers and the children. They also made a point, and they did this on their own. We didn't ask them to say these things, but they talked about how closely they work with their national AIDS programs. And I want to make that point because, again, a lot of times faith-based organizations are accused of not working or working in parallel to the national programs. They do, they continue to do so, and they really see themselves as partners with the national programs. I'll pick out just two examples that were given in terms of the pediatric work during that conference, but we had a number of other people from the field reporting during this. Caritas Rwanda made the point that it's now working on identifying HIV-infected children between 0 and 14 years at different entry points, so not just in the typical AIDS clinics, so postnatal care, immunization visits, family-centered HIV testing and counseling, and then referral from community programs to health facilities. They offer testing, both voluntary and provider initiated at community level during outreach programs. For the children younger than 18 months, they're doing DNA PCR testing and conducting that at 6 weeks and then following up with antibody testing at 9 months and 18 months. ART prophylaxis is provided to HIV-exposed infants in all health facilities, and they run about 60% of the health facilities in that country. ART for pregnant and breastfeeding mothers, but now working toward the B+ lifelong treatment. Task shifting to nurses, and then individual in-depth counseling sessions held both for the people living with HIV and for their caregivers to discuss testing of children, and then also support for the caregivers in order to help them accompany those who are living with HIV. The Christian Health Association of Zambia worked hard on health system strengthening, especially trying to overcome the stockout problems, and then also to strengthen the hospital-based facilities. But they also talked a lot about their community systems health system strengthening, and working with the community-based healthcare workers, building their capacity, working with the chiefs, the traditional leaders, and here they really worked hard with the chiefs, not only on getting people involved in testing and treatment, but also working with those traditional leaders that orient and initiate young people as they come into adolescence, and also working with those who are marrying so that they could also transmit the cultural values, the importance of respect for oneself and for their partners. Creating awareness on a public level, trainings and advocacy, providing transport to the care workers. So they bought bicycles for those care workers so that they could get out to the communities even more frequently. And then empowerment of people living with HIV, helping them to do the counseling, testing, and helping them to help people stay in care. Out of that Rome meeting, where these and others presented, the people themselves, the participants themselves, those coming from the field, developed their own action plan. And we made it a point that we wanted it their own. We didn't want it imposed by, with all due respect, by UN agencies or others. We wanted this to be theirs. And so they committed themselves as faith-based organizations to increase partnership and collaboration with all actors, to take a critical role in implementing the health and HIV-related targets of the Sustainable Development Goals, to assure access to treatment and provide not just the access to treatment, but also the social, emotional, and spiritual support that faith-based organizations do so well. It's part of their DNA. And then also to maintain focus and concern on marginalized, low prevalence, or other hard-to-reach populations when some are withdrawing the support for them. And then to also contribute to ethical and theological reflection, and to encourage religious leaders to do much more about leading people to testing and to care. As a result of that, we also worked with some of the religious leaders in the Catholic Church. And so Luis approached Cardinal Peter Turkson, who's the head of the Vatican's Council on Justice and Peace, and asked him to convene a closed-door private meeting with heads of pharmaceutical companies and diagnostics companies, as well as with government representatives, the UN people, and those working in the field. And we did that on 2 occasions. Cardinal Turkson, through his connections, was able to get us a beautiful spot inside the Vatican, in the middle of the Vatican Gardens, where it's the Pontifical Academies of Sciences that are based there. And we really had the time to have a dialogue. Short meetings, but dialogues. And it was amazing. In very short notice, we had the heads of pharmaceutical companies there, the diagnostics companies there, and also a number of high-level. We had the Minister of Health from Zimbabwe and other high-level ministers. And also, again, Debbie and Luis were very important leading figures at those meetings. It was very interesting to hear the dialogue that went on between the private companies, the big pharma companies, and the generic companies, and their willingness to start working together. We called a second meeting about that one month later, and again, they showed up. And they work toward now an action plan, and we're hoping to be able to start working an intensive initiative on a kind of super fast track for children in 3 of the countries that have not made as much progress during the global plan. And that also then, of course, fed into the new concept of the super fast track for children and adolescents that I'm sure we'll be hearing about quite a bit during this conference. So I thank you for giving me the time and also for including the faith-based organization contributions to these efforts.